Hello, everyone. This is Rachel Wall with Inspired Hygiene, and I am so happy to be with you this evening. We have quite an international crowd here with us. Folks from almost every continent are represented here. It's very exciting. So I want to thank you all for having me and taking the time to be with me this evening or whenever you're listening to this broadcast. And I am proud to be a active hygienist for the last 26 years, as well as a hygiene productivity coach and the founder and president of Inspired Hygiene, where we work with dental practices to help elevate their hygiene systems, services, and profits. And the title of today's webinar is Recommendation by Relationship. And I would love to thank Philips Oral Care for sponsoring this and for their ongoing support of Inspired Hygiene and our endeavors to really share the message of effective recommendations with all the people that we get to speak with across the country and internationally. So thank you very much to Philips. All right, so let's kick it off by sharing our educational objectives here. At the end of the webinar, participants, you will be able to explain ways to build strong patient relationships while increasing patient compliance for home care recommendations. Discuss how to create a customized home care plan, including products that address patients' unique risk factors. Guide your dental team to get on the same page with common product recommendations. And explain the benefits of both in-office dispensing and retail recommendations. So let's go ahead and get started. So recommendation by relationship is just that. Product recommendations really have the opportunity to strengthen the relationships that we have with our patients by finding out what your patient wants or what problem they want to solve and then giving them a solution. Providing our patients with the very best care and products that support that care is really the best way to build a strong, lasting relationship between you, the dental care provider, and your patients. And I use this slide all the time because I always love to just really bring home the message that it's all about our patients and it's all about the relationship we have with them. And Inspired Hygiene, we get a lot of phone calls from dentists who want our help with taking their hygiene team to the next level, helping them maybe overcome some of the barriers or obstacles that they've had getting to that next level. And there could be certain things like numbers, trackers, and ways that they're monitoring the hygiene department, but it all comes down to, typically at the end of the conversation, they might say, hey, the reason we called you is because we've been looking at our production in the hygiene department, or we've been looking at our procedure counts, but really the bottom line is we want to do our very best for our patients and take the best care of them as we can. And so that always warms my heart to know that I believe that really is at the core of us dental professionals, no matter where you are located, that you're really there because of your patients. And certainly we all have to make a living, and we want to be able to enjoy that. And we want to be able to connect with the people that we work with every day and those that we serve. And so I believe that this is one opportunity we have to really strengthen those relationships. So we're going to be doing some polling this evening to keep you interacting with each other. And so I want to ask you a few questions. And so I'm going to have you look on your screen for the poll. We're going to start this poll here. Is what obstacles do you face when recommending products? So I'd like for you to think about that, and you're going to see the polls show up here. So if you can just take a moment and just answer that. What obstacles do you face when recommending products? Love it. Thank you for responding. I'll give you just a few more seconds to do so. All right, wonderful. Okay, we're going to go ahead and close the poll here. And I'm going to share these results with you. So you can see here on this pie chart, it looks like 42% was probably the strongest message that you're sending me, is that you get some resistance from your patients. Maybe they're not compliant with your recommendations. The other thing, and not surprising to me, is that you just sometimes don't have enough time to spend on education, or aren't able to spend the amount of time that you'd like on education. And that's also a very common challenge in regards to that, and hopefully I can touch on that as well. But I want to focus, we're gonna really specifically focus on this resistance from patients, and I hope you'll get some tips this evening that will help you with that and really kind of get to the core of where some of that resistance may be coming from. All right, so thank you for sharing that with me. Let's look at customized home care, because there have been studies that have shown that the more customized our home care recommendations are, the more likely our patients are to comply with them and for them to get the results that they're hoping to see and that we're hoping to see. And so it can start in a couple places. It can start with the risk assessment. It can start with the clinical evaluation. But really, before we're making any product or protocol recommendations, it's important to consider not only the risk factors, but what you're seeing clinically, and then also that patient's level of compliance. And if you've recommended a specific home care regimen followed through, why not? A lot of times we assume that it's their level of commitment, or we assume that they're lazy, or we assume that they just don't want to follow instructions, or we assume that it's not important for them. I know I have been guilty of that. Or could it just simply be an issue of a preference? Could it be their lifestyle? Could it be their abilities? So I think it's important to always put these three things together, and where these meet is really the best home care plan for those patients, and giving them a choice that's within the boundaries of what you've determined to be clinically beneficial is really a great place to start. So, for instance, would your patient prefer a berry flavored fluoride gel rather than the mint flavor that you also dispense? I mean, this is a simple example, but sometimes we simply forget to ask, and we assume that they're going to accept whatever it is that we have. So it's also important for us to share with our patients the desired endpoint. What problem are we seeing, whether it's the risk or something we see in our clinical evaluation, for instance, a lot of plaque in an area. What problem are we seeing that we're hoping they can solve with a modification in their home care regime? And we've always got to focus on what is the benefit to them. So I think that's one of the keys. We're going to talk about change in just a moment, but what is the benefit to them that really helps overcome some of that resistance? So let's talk about change. Because a lot of times that's what we're asking our patients to do, right, is to change their behavior. And that's a tough one. And we see them, maybe 2 or 3 times a year, and we're asking them sometimes to make some significant changes to them in their behavior. So I want to share with you an analogy here that I love. This is from a book called Switch by Chip and Dan Heath. And Chip and Dan Heath say that 3 things have to be in alignment for change to really stick, right? For some real change to happen. One is our rational mind. Our rational mind, our emotional mind, and then our path. And they use this example or this analogy of a rider on an elephant to illustrate this. And so one of these, either the rider or the elephant, one of them represents the rational mind, and the other represents the emotional mind. So I would love for you to think, which one do you think? If it's the rider or the elephant, which one do you think represents the emotional mind? Well, it's the elephant, because really and truly this rider can feel like he's directing this elephant and guiding the elephant, but if that elephant decides he wants to go over into this grass and have a bite to eat, then the elephant's going to go where the elephant wants to go, right? Our emotional mind is really what drives a lot of that change. And so another way to look at this is clarity. The rational mind needs clarity, right? There need to be very clear expectations on what that endpoint is for the patient. So if we just say, you really got to brush more, then that's a little vague. Brush more often, brush more frequently, brush for more amount of time, brush harder. What does that mean, brush more? Brush in more areas. So we've really got to be very specific with our patients. And your intraoral cameras are always a great tool for this, because you can show the patient exactly where it is that you want them to brush more, right? I would like for you to brush longer. How many times a day are you brushing? I'd love for you to spend more time, brush longer. I'd love for you to access this area. So clarity, right? Very clear. So this is that rational mind. The rational mind needs clarity and specific expectations. Next is that emotional mind. This is the desire, the motivation. Where does that come from? And really and truly that comes from how is this going to specifically benefit the patient? So it's really not enough for us to say, you really need to floss. Or the example I like to use is, well, you know, it's time for your x-rays, and that's our protocol, is once a year. Well, the patients don't really care about our protocol, and they don't really care that I want them to floss. It's not about me, right? I really want you to floss more. It's not about what I want. It's really about that patient. So instead, you know, you've got a lot of fillings between your teeth. You've got quite a few crowns. And in order to remove the plaque between your teeth and really reduce your chance of getting cavities again between these teeth, we got to find a way that you can really clean between these teeth easily. All right, and then the next thing is that, keep making it easy. That's that path, right? That path has got to be clear for the emotional mind and the rational mind to be able to travel to the desired endpoint. So for that behavior to change, there can't be a whole lot of obstacles there. And that's when we really get results. So let's look at that. Let's look at how we can really help our patients. How can we make it easy, and how can we really create this motivation and desire to eliminate some of that resistance that you're experiencing? So this is a patient that I saw several years ago in clinical practice, and looking at her, you know, the question is, is this a cosmetic case? Well, obviously she has some cosmetic needs, but you're seeing more than that, and you're probably coming up with some things like, gosh, it looks like she's got some wear. Does she have a grinding issue? Perhaps there's some erosion. Is there decay? Does she have dry mouth? What's happening? And so it's important for us to look a little deeper, right? To do more than a superficial look and really figure out what's going on with this patient. So as soon as you see this, you know something else is going on, right? And you guys all probably have the exact correct guess of what's happening with this patient, right? This is a patient, you can easily see that there's extreme erosion, decay. You know, if the medical history didn't reveal it, this would be the time to ask about medications, to ask about a history of bulimia. You might say, you know, at what point in your life have you eaten a lot of acidic foods? Or have you experienced frequent vomiting or reflux? And this often will open the door to some sincere conversations. That's exactly what happened with this patient. And once we opened that door, she was completely open with us about, you know, what had been happening in her life, and that she was in treatment for bulimia and also for substance abuse. And so don't be afraid to ask those questions, because that's really going to help you get to the heart of whatever product you're recommending. Is how is this going to benefit this patient, and really how can we help motivate her? So this patient presents with what I call the perfect storm. You know, this is an example of just about every risk factor for decay and erosion in play at the same time. You know, she had a history of long-term bulimia, alcohol abuse, antidepressants, which create dry mouth, soda, heavy soda, and sweet tea consumption, and they've all played a part in this condition. And she, you know, she didn't voluntarily reveal this, but over time, you know, and over some questioning, we got to the bottom of the problem, and she's been in treatment for years, and she's very stable, and she's doing really well. So here's the thing, you know, we look at her risk factors. Now here she is restored, or at least partially restored, right, and looking beautiful. This is a complex example of our challenges that we face, but it's really, we've got to take our responsibility to diagnose and recommend the proper treatment seriously, and we've got to take just as seriously that it's our job to help the patients manage their risk. So if we were to put these restorations back in that same oral environment, they wouldn't last very long, and we would have failed her, right? Something has to change, and it's important to tell our patients just that. Sometimes you can't beat around the bush. You've got to let them know, and in this case, we were able to really express to her the benefits. She wanted to change, right? She wanted this beautiful new smile. Now, here's what has to happen, patient, in order for this to be maintained. And here's how we can make it easy for you. So we've specifically addressed her risk, right? We've connected the dots for her on the medication, on the lifestyle, and on what she needs to do to get to the next point, all right? And this is really where this risk assessment where these critical thinking skills come into play. You know, we've got to quickly assimilate all this information and collaborate with our team, right? Our doctors, our hygienists, our assistants, to really develop a comprehensive plan for her. So whether you're using Cambra, you're using some DNA genetic or pathogen testing or HPV testing, whether you're using an occlusal analysis technology, you know, whatever those things are, or combination of those things, that's what's going to help us identify where these risks are. And also just your anecdotal experience with patients like this, right? What are you seeing and what do you know to be true based on science and based on your experience? What are the risks here? And then we've also got to determine priorities. You know, one of the questions that we get a lot is how do we present all of these products to the patient without overwhelming them? And my answer is sometimes you don't. Sometimes you've really got to determine what is the first priority here and how do we triage and handle that one thing and get that under control, and then we can address the others, right? So it doesn't mean we necessarily don't share with our patient their risks in other areas, but sometimes we've got to baby step it. And if we dogpile and we recommend too many things at one time, very often we can miss the boat and we can overwhelm our patients, and then they don't move forward with anything. I love this picture because this reminds me of me as a younger hygienist. You know, this was kind of what I was taught in school, is that if our patients weren't doing what they needed to do with their home care, then you know, it was really their fault. It was their fault that they, you know, weren't seeing the results that they needed to see with their periotherapy, or it was their fault that they were getting decay. But we really didn't focus as much back then, back in, you know, 1991, on the risk assessment, I don't believe. And that's really where this comes in, because, you know, even the AAP, the American Academy of Periodontology, says that 50% of the difference in severity in my periodontal disease and yours is based on genetic influences. So there's a huge part of the dental disease, whether it's periodontal disease or whether it's caries or other conditions that are happening, there's a huge part of this that is genetic. There's a huge part of this that is the oral environment, right? If it's a pH issue with regards to decay, that patients have some control over, but some of it they don't. And so it's important for us to look at that. And there are ways now with DNA testing that we can see, you know, what this patient's risk is for inflammation. And so I think the bottom line about this slide is really that it's not about me as a hygienist. It's about my patient. And it's not about what I want them to do, and it's not about me badgering them about flossing. It's really about what's going to work well for them to get them to the end result. So I want to ask you this next question. I'm curious to hear your thoughts on this. What percentage of your patients use string floss daily? So I'm going to start this poll here for us. What percentage of your patients used string floss daily? And this is going to probably be different in different parts of the world. I'm really curious to see this. Yeah, so this does not surprise me. You're saying 60% of you, or more than 60% of you, are saying 25% or less, 25% or less are flossing daily. Okay, let me show this to you so you can see this. This is pretty cool. So that doesn't surprise me. You said only 6% of you said over 50% of your patients. 8 of you said over 50% of your patients are using string floss daily. All right, so 64% of you said 25% or less. So let's look at this. This is interesting. So U.S. News reported a CDC study that said 30% of Americans floss daily. So I think that that's probably a pretty high number. And based on what you said, you probably would agree. But I think it's good for us to have a realistic view of this. So that's not too far off. You said 25% or less. They said 30% of Americans floss daily. And so does it make sense for us to continue, recommending string floss to 100% of our patients? Now, that's not to say that string floss may not be one of the best interproximal cleaning tools out there. And you all have differences of opinion on that. There are some of you that are going to say, no, I get much better results with some other type of interproximal cleaner. So let's look at the study that Philips is going to share with us. And this might open our eyes to some alternatives to string floss. All right, so they did a study to really assess the effects of the Sonicare AirFloss Pro. So this is a burst of air with some type of liquid. It can be water, it can be an antimicrobial rinse, very simple tool that's placed right at the interproximal area, and one button click is a small burst of air and liquid that really dislodges the biofilm. So what is the effects of that air floss when used with antimicrobial rinse on gum health and plaque removal? All right, so they used a manual toothbrush with string floss, and then a manual toothbrush with the air floss and antimicrobial rinse. They had about almost 300 participants, randomized parallel study, and they looked at gingival inflammation, gingival bleeding, and surface plaque. All right, so the point of this is we've got to believe in whatever our alternative solutions are. We've got to believe in it. So this is the science that shows us that. So here's the summary, and then I'm going to show you the detail in just a second. So string floss versus the air floss. Again, they used a manual toothbrush alone. Obviously, they saw great improvement in all of those things that they were measuring once they added an interproximal cleaner. So the second group was manual brush plus string floss, and then the third group was the manual brush plus the air floss with an antimicrobial rinse. And what they found out is that the air floss with the antimicrobial rinse had very similar results to string flossing, okay? So you look at this, and this first one here on the left shows gingival inflammation, right? So we had a reduction in gingival inflammation. You're looking at the blue box is manual brushing alone. The purple line here, the purple bar, is the string floss. The red, dark red, is air floss with Listerine. And then the yellow or the gold is air floss with the Breath RX. And so you can see this is week 2 they measured, and then at week 4 they measured, and they saw the gingival inflammation index improve, right? Reduction in gingival inflammation dramatically with all of these interproximal cleaners. Next section of, next section here of bars, you can see week 2 and week 4. They had an improvement in reduction in plaque index. So they had reduction in plaque dramatically with any kind of these interproximals, and you can see very similar results with the air floss as with the string floss. And then this third area was gingival bleeding, right? And bleeding is our sign of inflammation. Bleeding is the indicator that all levels of periodontal disease and gingivitis have in common. That is our sign of inflammation, and you can see dramatic improvement in bleeding reduction from week 2 to week 4, right? Dramatic. You had a 40% generalized, 40% reduction in bleeding from the baseline with the air floss and the antimicrobial. So my point of all this is to say that don't overlook some of your alternative interproximal cleaners. Philips is not suggesting that everyone that is a super effective daily flosser needs to throw all that out and go to the air floss. What they're suggesting is there's a lot of patients out there that aren't intercleaning at all. And this is a great solution. And what they found in their studies is that 96% of non-flossers used it 4 days a week. Well, gosh, wouldn't that be a great improvement from no interproximal cleaning at all? And aren't we happy to have that biofilm disruption? And what difference could that make in our patients' overall inflammation, plaque, and bleeding? So how do you start this conversation with your patients? And how do you do that in a way that it doesn't completely eat up every bit of time that you have in your appointment, because you have a lot of things to accomplish? One of the things that I have found that works really well to open the door to conversations like this is open-ended questions, right? We're going to go over this a couple times because this is super important. And so instead of saying, you know, are you taking any medications, or have you had any changes in your medications, you might ask, what medications are you taking? Right now you've got an open-ended question. Or you could be looking at their list of medications and saying, okay, what of these medications are you still taking? Are you still taking the Zoloft? Are you still taking the metformin for your type 2 diabetes? Do you ever feel like your breath isn't as fresh as you'd like it to be? That's a great way to open the conversation for interdental cleaning, for power brush, for a breath freshening mouth rinse. You know, I find that we're often afraid to mention bad breath, but who, if as a hygienist and a dentist or a dental provider of any kind, right, even our dental administrative team, if not us, then who's going to help our patients with this? So this is a way that I have found it's a little less awkward to ask. Do you ever feel like your breath isn't as fresh as you'd like it to be? How long have your gums bled like this? Right? This is not something new. That also gives your patients an idea that this isn't something that just happens when you come to the dentist. Tell me about how you clean your teeth at home. I found this one super helpful, right? Instead of, do you floss every day? No. Tell me how you clean your teeth at home, right? And they can share with you, well, I know I don't really floss as much as I should. Okay, and why is that? You know, how do your teeth feel when you eat something cold, right? They might tell you, I get some sensitivity, or they feel fine. Do you ever notice that your teeth quickly become stained after you've had them cleaned? So all of these are open-ended questions that you can ask when you're suspecting that a product that you recommend might be helpful to them, that helps them kind of get the dialogue going and helps them discover that there might be a problem there, and then you can offer that solution. And here's one tip that I would give you to help work this in with your time, is utilize these products in the course of your appointment, right? As a hygienist, utilize these products in the course of your appointment. So think about it, right? When you're using your ultrasonic, you can share, hey, you know what? This is similar to this power brush that I'm recommending for you, right? You feel how this tip is vibrating. It does a great job of disrupting all this bacteria under your gums and helping your gums heal, right? This power brush that I'm recommending is similar to that. How about remineralization, right? I see you've got these white spots. I'm going to show you these areas, and here's what I'm going to do today, is I'm actually going to polish with a product that's going to help remineralize. It can help these areas get hardened and not turn into a full-blown cavity. And this is a product that I would recommend that you use at home too, and I'm going to show you. You're going to get to experience it. You know, irrigating. Perhaps you have an antimicrobial rinse and you'd like to introduce it to your patients when you're irrigating after scaling or root planing, right? As an added benefit. There's not a lot of heavy science in the end result of irrigation with scaling root planing and making a big difference in that. However, I believe there is a lot of evidence in utilizing these products and showing your patient their place in their oral care regime. And then what about desensitization? Can you place a desensitizer for them at the end of the appointment and then share with them what they can use at home to reduce that sensitivity, right? What are all these things? How can we work this into the appointment? With time management, we can't always have a 10-minute conversation about flossing, but we can talk to them about flossing as we're doing it right after we polish. So think about how you can work those things into your appointment. And then I love this video. I want to share this with you. When we talk about ultrasonics and our power brush, the Sonicare, you know, this is why I believe in this technology. What you're seeing here is an in the lab test of the power of the fluid dynamics created by the Sonicare. So over here in this black area outside of the view is the brush, right? And then this black line is representing the tooth post in the interproximal space. What you're seeing is this big blob of biofilm is being released and disrupted just by the fluid dynamics, that motion that is occurring and is happening with the water and the sonic vibration of that brush. So just look for ways like this that really help you develop that conviction about the products that you are recommending to your patients, because that's a huge piece of this. All right, so these are the things that you might recommend. You might have other items on this list, right, that we don't have here, like a desensitizer, right, like a pH booster. There's a lot of different things in this category of products that we can discuss. And really and truly, you know, the power in this is, how do we help our patients overcome the risk? How do we help them disrupt the biofilm? How do we help them change that oral environment so that we're reducing the risk here? So this is just an example of various products that you might use and how they can specifically address certain risks. So for example, you've got a gel here for dry mouth, that's specifically for dry mouth. You've got remineralizers here, a fluoride, and I'm going to talk to you a little bit about remineralization in just a second. We look at, you know, how do we raise the pH with the basic bites, and then of course we have our interproximal cleaner, our air floss here. You know, how do we help our patients disrupt those bacteria? So it's important to have some specific products that you as a team really believe in, and that are easy for you to recommend and easy for your patients to understand what the benefit is for them. So whether you've determined that their risk is dry mouth, whether you've determined that it is a low pH, or interproximal plaque and biofilm, or you know, recurrent decay, you've got a product, you've got a go-to product for that that you can recommend with confidence. And this is just another example, right? I showed you the biofilm. This is just another example of why I personally believe in products with nanohydroxyapatite, right? You look at the study and you see these, you see this illustration of this. This is where they used acid to open the tubules, to etch that, open that up, and then B is your 2% sodium fluoride has partially closed those tubules. C is the nanohydroxyapatite, shows more closure there, and then D, the nanohydroxyapatite plus the fluoride, is almost nearly complete closure of those tubules. So imagine how that can affect sensitivity, how that can affect remineralization. And so just, this is used as an example just to show you how science really can help us develop our sense of belief. It can address our rational mind. Remember, we talked about change. So this applies to us too, not just our patients. It helps address that rational mind, but then we can look at how does this really benefit our patients and how does it improve their experience, and that really develops that emotional piece. All right, so let's look at a couple specific solutions, right? When we ask our patients, what medications are you taking, and they reply that they're taking Zoloft and metformin, you know, while they may not have revealed that they're dealing with depression and managing diabetes, their answers to this open-ended question point us in a very specific direction, right? We're thinking about perio, we're thinking about dry mouth, and so we've got to connect the dots, like I said earlier, for our patients with regard to their systemic health and their oral health. They often don't know why their medications are important to us, and this is a perfect opportunity for us to show them and show them how we are really addressing their whole body health. So, you know, again, we talked about how do we recommend all of these products without overwhelming our patients, and my answer is that we don't. We've got to really set a priority and figure out what is most important today. So you might today, this patient might present, right, remember our clinical assessment, they might present with active periodontal disease. And so the first thing that we're recommending for them may be an antimicrobial rinse, right, that's alcohol-free because they have a dry mouth. We might be recommending the power brush and an interproximal, cleaning device, something that's going to help them disrupt that biofilm. That might be the first thing on our list. So we've got to really think critically and choose this. You know, we also ask our patients, this is a great example of providing patients with the resources to solve their problem, right? We ask that question, do you ever feel like your teeth get stained really quickly between your visits? Here's a great solution, right? This is the Sonicare that helps reduce stain. This is a before and after without any scaling or polishing in between, right? How can we help our patients address that stain so that their visit is easier with us, and so they're happier between their visits and they think about us, and this builds our relationship. So here's the thing. When we're connecting the dots for our patients, then that's how we are really building our relationships, because it helps our patients understand that we care about their specific needs, and that we care specifically about what matters to them, and that it's not just about what we recommend and what we what we want the patient to do, that it's really about them. So I had a question. I'm gonna ask this question. Answer this question rather. What if the patient does not want to spend the money even if they need the item? How do I overcome that? It's a great question. And so what I would say is, again, we've got to focus on what is the desired outcome, what is the risk, and I always teach in all of my programs, how can we create value for our patients that far outweighs the cost? How can the value far outweigh the cost? So one of the things that I have found that works is I'll look at what has the patient already done? What is the patient already invested in, right? Have they had periotherapy? Have they completed some restorative dentistry? I mean, obviously they're in your chair for a reason, because they value the care that you're providing. And so how can I look at what they've already invested in that I know they value, and how what I'm recommending can either prevent a future more expensive problem or can protect the investment they've already made. So, for example, patient John, right? I noticed that you have spent a lot of time and resources and energy in restoring these back molars. You've got these beautiful crowns here. And the thing about these crowns is they're super strong, and they all have a margin. There's always a place where that crown meets the tooth, and that is a vulnerable area. That's if a decay is going to start anywhere, if a cavity is going to start anywhere, it's going to be right there. And sometimes that cavity can grow and get under that crown, and then the crown has to be replaced. So what I'm recommending is this product to help reduce the chance of that, right? It can't completely eliminate it, but to reduce the chance of you getting that decay around that crown and really protect this investment that you've already made. So think about this. If this is a $20, right, tube of nanohydroxyapatite fluoride gel, right, compared to the $800 crown, over the course of 3 or 4 months, think about that, right? That's a small investment to protect this big investment that you've made. Or if that prevents you from getting one cavity, then all of a sudden your return on that investment is 6 or 8 times, right, depending on what your filling fee is. So how can I show them that the value of this product far outweighs the cost? And then, are there some low-cost options, right? Are there some low-cost options? For example, one of the, I would encourage you all on Viva Learning here to go and listen to Dr. Brian Novy, N-O-V-Y, listen to his webinar on caries prevention and remineralization. He's an excellent speaker, and he talks about even some low-cost options for that, things that the patients can easily get themselves that can reduce their risk. So what are some things that in the meantime that they can use now and improve that, and Anne says she loves talking about the cost of scaling with patients and educating them about their endodental cleaner, and they usually end up walking out with the product that she recommends. So that's awesome. Thank you. Another question we got was, please discuss a dry mouth routine, as this seems to be an increasing problem in the population is aging, and many of my patients are on multiple medications. Man, you're not kidding. This is a major issue, is dry mouth. And so I think with dry mouth, we're always looking at controlling the pH, right? Making sure the pH is staying in a basic environment rather than acidic. So there's always the quantity and the quality of the saliva that we need to address. I had mentioned earlier that Periosciences product, they've done quite a bit of research actually on dry mouth and have some gels and things that specifically address that. Also, there are lots of products out there, but I would say you want to have a remineralization product, as well as there's another line that I showed, Carie Free, which is really great for managing the pH, and their products also have the nanohydroxyapatite. So I think we need to look at addressing the quality and the quantity, and then also looking at what habits do our patients have that might contribute to problems when they do have the dry mouth. So lots of different things like that can help that. Yeah, so great questions. As far as remineralization, we got another question. In my research, I have seen in my research and in my clinical practice that anything with the nanohydroxyapatite combined with the fluoride is a great remineralization product. It's a hard word to say. All right, so how do you recommend these products? I'd love to know. So let's do another poll here. So I'm going to open the poll here. What is your primary method for recommending products? Do you prefer to have patients purchase products at your office? Do you give them a verbal recommendation to purchase at the retail store? Do you give them a written recommendation to purchase at the retail store? Let's see what we come up with here. Great feedback coming in here. Thank you guys so much for participating in the poll. I'm going to give you just a couple more seconds. This is really interesting. So it looks like the majority, let's show you the results here. So it looks like the majority of you are doing a verbal recommendation. So this next section is going to be really important. Really pay attention to this because I think this is going to make a big difference. The remainder of you are really split between patients purchasing products at the office. About 28% are recommending purchase at the office, and the other 24% are actually giving a written recommendation, which is super. So let's look at that in a little bit more detail. All right, so I believe that there are certain products such as the interdental cleaners, the Sonicare, the power brushers, the antimicrobials that really affect the outcome of our periodontal therapy, for example. And so when possible, I always recommend as a hygienist and as a coach to include your oral care products in your treatment plans. If you are able to bundle those within your fees, that's super. If you're not able to do that, I would at least include those in the treatment plan and let your patient know that this is part of that therapy package, right? Because you've seen that ability of biofilm, it's critical that they be included here because that's really where the healing is coming from. It's coming from the patient's immune response and from that reduction in the biofilm, right? Those two things happening create that healing. So, discuss the periotherapy package as rather than, giving the patient a laundry list treatment plan with individual fees, present it as a package. And this is what it takes for them to really get the best results with their treatment. Some patients opt to, like I said before, include this in the treatment fee and offer them as gifts to the patient to really support their treatment plan. There's a lot of different ways that you can do this, but the bottom line is really including this to protect their investment, and again, this is what you're investing in the treatment, and this is going to give you the best option. So you can see here, right, the home care products as part of this therapy plan. Always recommend that, and make it easy. This is the key. So my thought is that the dispensing in the office where the patients are and where you are is the easiest thing for our patients to do. It's the easiest way for our patients to get that. So that's the advantage in my mind of dispensing from the office, right? We can make it easy. There's no additional trip to a retail store. We can offer it at a very competitive rate, and we can have it right there. This is a picture from one of our client offices at holiday time. They had these packaged so their patients could literally buy their loved one a Sonicare. It was already wrapped, and all they had to do was put it under the tree, right? And so talk about making it easy. There are ways that you can do this, right? You can have these products available for Valentine's Day. You can have them available for Mother's Day. You can have them available for whatever holiday happens to be taking place in your part of the world. But the key is making it easy. Remember, we talked about those three things that have to be in place for change to occur. One is that clarity and the expectation of what that endpoint is with the care. 2 is the motivation, what is in it for the patient, and 3 is making it super easy. So this is the epitome of easy. And here's the thing, is This is a really interesting study that I found a while back from the Journal of the American Academy of Dermatology. And what they said was that a third of written prescriptions go unfilled. Now, this is a medical prescription, right, for a medication prescribed by a dermatologist. And even a third of those go unfilled. So we've got to make it easy for our patients to follow through on the recommendation. And so if we're recommending it and we're dispensing it in the practice, then we reduce the chances of that happening. So we really want to set our patients up for success. That's our goal as dental professionals, right? And you know, as we said before, that one huge aspect of case success is the ability of the patient to maintain that oral care at home. So when you buy an $80,000 Mercedes, you know, you wouldn't dream of washing it in an abrasive detergent, right? So, and hopefully the car dealer instructed you on what types of products are preferred to maintain that impeccable shine in your new dream car. And the same is true for our patients. So remember the one that I showed you before is, you know, we've got to share with her how she can maintain the shine on those veneers, how she thinks she can maintain those in a very healthy way. But here's the thing, what if we do decide that we want to recommend our patients to go to a retail location? How do we make that easy too? We'll talk about that in just a second. Let's look next at what do patients think of practices that dispense from the office. This is really telling because I have some clients that say, gosh, I feel like patients are going to think that I'm you know, trying to sell them something, when in reality what this is revealing, what I have found to be true, is that our patients really respect that and they appreciate us making it easy for them. So a couple things to point out here is 94% of these patients who were interviewed, over 1,000 patients, you know, they agreed, I trust the products that my dentist recommends, okay, no brainer. And that trust is building your relationship with your patients, right? 85%, I feel more confident, I would feel more confident that I was buying the power brush that was right for me if I bought it from my dentist. Makes sense. 69% said, I think dentists who recommend rechargeable power brushes are more up to date with current dental practices. And then look at this, 53%. I think dentists who sell power brushes care more about their patients. Wow, that's interesting. I would have never thought that. So just a little food for thought here. So what if we are choosing to make the recommendation for our patients, right? What are the advantages there? I mean, one of the advantages of a retail recommendation is that patients get to compare what you've recommended, right? They get to see what you've recommended and know that you took the time to, again, make it easy for them. Even if you're not dispensing in the practice, if you're recommending and you're giving them a written recommendation, right, you're making it easy for them. So they go into this aisle, you know, and there are thousands of products here. Or they go onto this website and there are 452 choices when we search for a power toothbrush, right? 452 choices, that's quite a lot. So we've got to, again, remember, first step is that clarity, being really specific with our patients on what it is that we're recommending. So rather than saying, I recommend a power brush, what is the brand that you believe in, right? What do you believe in and how do you make a strong recommendation? The other cool thing about websites is they can also see reviews. I like that. So they can see that the product that you have recommended has gotten great reviews. This is my recommendation for those of you that said you are recommending products verbally. I would encourage you to take the next step and create a written recommendation, whether that is a prescription like form that you have created that has your types of products that you really believe in and you really recommend, or rather that is something like this, right? A coupon that your patient can take to the store. It's going to tell them specifically, right? You can even write on here which Sonicare that you recommend, which one is your favorite and why, right? So they know exactly which one to buy. And so now they've got something in hand that's going to really help them know what to choose. So you've been specific, you have outlined the benefits to the patient, and then you've made it easy for them, right? Okay, so we've talked about the patients and how to help them make change, right? How to help them kind of move the dial on this. Now let's talk about your team, because it's critical that your whole team is really on the same page. This is one of our objectives, was how do you get your team on the same page with common product recommendations? It's tough if you've got multiple providers and one person likes this product and the other person likes this product, and the patient gets confused. And here's the reality, is that a confused mind does not buy. And we've got to make sure that we're not confused, right? Because here's the deal. When there's a struggle on the inside in that emotional mind, and we're not sure we really believe in the product that we're supposed to be recommending, when there's that struggle on the inside, there's always a struggle on the outside. And that struggle on the outside might look like we're not recommending a desensitizer. We're not recommending adult fluoride. It might look like we're not recommending an interproximal cleaner because we haven't developed that belief on the inside yet. So the same thing is true with us and our teams. We've got to be super clear. Which products are we recommending and why, right? We've looked at the science. We have convinced ourselves, okay, rational mind. All right, I believe that this is the best product for the patients. You know, I've seen this biofilm video. I've seen this scanning electron microscopy photo that shows the tubules closing up. Okay, so that's satisfying my analytical, my rational mind, and we're really clear on which products we're recommending. Right? The next thing is my motivation, my desire. And for us as dental professionals, that really starts with why. What is why is this beneficial to the patient? Right? How is this going to help them? Is it going to prevent decay around those crowns that they've invested in? Is it going to reduce their sensitivity? Is it going to make their visits easier because it's reducing stain between cleanings? We've got to lock in to the benefit to the patient and be able to express that. It can't just be about increasing production, selling more product, or because, you know, our lead hygienist says this is the product we need to choose. We've all got to get on the same page with this. And then how do we make it easy, right? How do we make it easy for ourselves to recommend these products? Okay, same process. So one way you can make it easy is in each operatory, you might have that product displayed. Right? You might keep a couple of your nanohydroxyapatite fluoride products in there. You might have your air floss in there so that you can have a demo unit and kind of demonstrate on a Dentiform, hey, watch, see how easy this is? This is not like string floss. All you got to do is point and shoot, right? See how easy this is to use. There's not much mess at all. It's super simple. So have those things there for your patients to really be able to utilize and to make it easy for yourself to recommend as well. So as we look at risk assessment again, you know, just always, you know, look specifically at each area. So if we're looking at the area of, you know, decay, what is our patient's risk here? What about occlusion, our health history risks, right? Medication risks, dry mouth. Look at all of the conditions specifically with your patients. Look at all of those conditions, right? And here are some questions that you'll want to ask yourselves. You'll want to say, what product for each of these conditions, right? So for periodontal disease or for decay, high-risk decay patients, what products will we offer? What is the specific benefit? How can we make it easy, right? How will we dispense this? What is the cost to the patient? Set that so everybody knows. What are we going to be dispensing in our practice? What are our over-the-counter retail recommendations, and how are we going to have a written recommendation? Sometimes, guys, it can be as simple as writing it on the back of the patient's next appointment card, right? Specifically what it is that you're recommending, if you don't happen to have a coupon. You know, what are the verbal skills? What's the communication to the patient that we're going to use to really drive this home, okay? To really drive this home and make this really clear. So I want to thank you all for being with us tonight. I'm Rachel Wall with Inspired Hygiene, and I encourage you to make those strong, confident recommendations and build those relationships with your patients. Thank you very much.